The biggest misconceptions that we've seen as we work with both gun owners and mental health professionals is this idea that either block is monolithic. The reality is that there's an entire world of cultural and thought diversity inside of mental health care, and another whole different world of diversity of thought and culture and lifestyle and even purpose inside of the gun owning community. Why does someone own a gun really does have a lot to do with the initial conversation about whether or not they're going to be comfortable being without that firearm during a mental crisis or at any point of intervention. So just getting the mental health community to understand that all gun owners aren't the same, that yes, there are some generalizations you can make, but that it's really important to understand each person as an individual, which obviously they get in terms of providing mental health care. But when they look at a community that they aren't part of, sometimes it's very easy to fall into generalizations. And I would say that the gun owning community is guilty of that as well, looking at mental health care as if it's monolithic, as if everyone has the same agenda or everyone has the same training or everyone has even the same process to reach the desired outcome. Mental health care is far more complicated than I think a lot of people outside of that community understand. It's just as complicated as physical health care, or at least as complicated as that. And there's a lot of different ways people need help. There's a lot of different ways people can get help. And that means a lot of different practitioners. So really understanding that the diversity inside of each group has been, I think, one of the most important messages for Walk the Talk America to share.